Last year, the world was witness to the largest and most widespread Ebola epidemic in human history, affecting millions of lives in West Africa. It is now over a year since the initial announcement of the outbreak, and blessedly, there has been a tremendous decline in the number of cases of Ebola. However, much work still needs to be done. The consequences of this horrific disaster continue to plague the survivors, as well as the families that have lost loved ones. Madam Chair, last year we saw the epidemic deteriorate from a disease outbreak to a humanitarian crisis, to a catastrophe that threatened the stability of the entire region. Diseases know no bounds, and the widespread suffering felt by the communities and homes in West Africa was immense and still is. During the crisis, an immediate response was critical. The world came together to send resources and aid to help those in need. Israel donated $8.75 million to the Multi-Partner Trust Fund, as we recognize the vital need for international collaboration in responding to the crisis. Israel is a small country, but this contribution was the sixth largest out of all donating countries and the highest contribution per capita. Israel is no stranger to immediate emergency response and was committed to taking part in the worldwide effort. Israel quickly mobilized and sent field clinics called Hospitals of Hope to Liberia and Sierra Leone to be run by specialists who also helped to train local health workers to fight the disease. These mobile clinics came fully equipped with 20 hospital beds, isolation kits, protective clothing for the medical staff, and all medical equipment needed to treat patients. At the same time, Israeli NGOs worked on the ground to help locate and recruit additional medical staff. Madam Chair, in the aftermath of the Ebola epidemic, Israel understands the need for continued support for the survivors and affected families. The needs of the people in this region have shifted from the immediate to the long term. The focus of our efforts should be to address the needs of the survivors and to help restore properly functioning health services, especially in the rural communities. Working closely with the United Nations Development Programme, we reassigned the use of the clinics to best serve the people living in these communities. Israel, an Israeli-based humanitarian agency, entered into a standard project partnership agreement with UNDP to transform one of above-mentioned clinics into a semi-permanent outpatient facility. This facility will provide a range of health services to the surrounding area, including maternal and child health care, specialist care for the long-term effects of Ebola, and psychosocial services. This collaboration, which will combine UNDP's experience with supporting and implementing recovery processes with Israel's day-to-day management of the clinic, we are certain will be vital to its success. Madam Chair, an African proverb teaches that disease comes and goes like the rain, but health is like the sun that illuminates the whole village. It is our duty to ensure that the devastated communities in West Africa are restored to full health so that these countries can thrive once again. Thank you, Madam Chair.